Hi, I'm Dr. Andy Thompson. This is COVID-19 update, December 21st, 2021. Omicron. We're being told by local health units to brace for a wave of COVID-19 infections. It's been widely reported that the initial data out of South Africa shows the Omicron variant seems milder in terms of severe illness. This has been met with a lot of uncertainty given differing underlying population immunity. For example, would Canada behave the same way as South Africa? Well, let's see what's happened in South Africa. South Africa has had 4 waves of COVID-19, and the last wave being Omicron. Here are the corresponding number of deaths. So the first wave, the second wave, and the third wave. But there's been no increase in the number of deaths with Omicron, and this is where this thought that it's milder comes from, understandably. When we look at vaccinations, South Africa has much fewer vaccinations than other countries like Canada, the United Kingdom, Denmark, and Netherlands, about 27% of people. But South Africa has had a lot of natural infections and thus has acquired a lot of natural immunity, which is likely doing a good job protecting people from Omicron. What's important to note as we look at the other countries is the interval between vaccinations. Canada has a 4-month interval between first and second doses, whereas Denmark, Netherlands, and the United Kingdom had about 3 to 4 weeks. We look at the booster doses now. United Kingdom and Denmark are certainly ahead of Canada, but hopefully will improve. And if we look at testing, Denmark and the United Kingdom are certainly outperforming the Netherlands and Canada. If we look at prior infections, the United Kingdom has certainly had the most infections in terms of the Delta wave. Early on, Netherlands had more infections. And Denmark and Canada have gotten through relatively unscathed in terms of infections. If we look at Omicron, though, different story, where Denmark has skyrocketed up, as of the United Kingdom and the Netherlands, and Canada is on its way. The United Kingdom's had lots of infections, lots of background infections, especially Delta. The Netherlands is second, they had more infections early on, and Denmark and Canada have had relatively few infections. So let's look in depth at the United Kingdom. And this is their daily new confirmed COVID-19 cases. And this is the waves of infections. And this is the number of patients in hospital. And you'll see with this Omicron wave, we haven't really seen a blip in hospitalizations, and nor have we seen any uptick in the number of deaths in the United Kingdom. Good news. Why? Well, they had a high background rate of infections, probably helping them. They had a shorter vaccine interval. And they had a good booster program. And also, is Omicron relatively mild? All right, let's look at Denmark. So here's the number of COVID-19 cases in Denmark. This is the Omicron spike, which is much higher than they've seen. And here's the number of patients hospitalized. Again, the number of patients hospitalized, even in the Omicron, is much smaller than the other peak. Here are the number of deaths. Again, they've had a little blip in the deaths, but not certainly like the other peak. Conclusions in Denmark. They had a lower background rate of infection, which doesn't help them. They've had a short vaccine interval, but that doesn't help them. But they have had a high vaccination in the population. And they've had a good booster program. So they're going to be okay with this. Let's look at the Netherlands. Again, number of patients hospitalized with COVID in the Netherlands. They've had a little bit of a blip as well. Conclusions here again, they've had a low background infection rate. Doesn't help them. They've had a short vaccine interval, but they do have a lot of people vaccinated. Where are we in Canada? So there's our spikes in Canada. And this is the number of COVID-19 patients in hospital. Again, you really haven't seen an uptick in hospitalizations. And here are the number of COVID-19 deaths in Canada. And again, we haven't seen an uptick in any deaths. Conclusion, we've had a relatively low background infection rate. That doesn't help us. We've had a long vaccine interval that likely helps us quite a bit. And we actually have a lot of people vaccinated. Our booster program, it doesn't help us, but it's getting better. What about Ontario specifically, where I live? Well, March the 1st, 2021, we had 10,570 active cases, about 311 in the ICU. Our active cases increased 3 weeks later by about 1.3 times. We had 1.07 times in the ICU. It doubled by April 1st. ICU cases went up 1.4 times. It quadrupled by April 20th. ICU cases went up 2.5 times. And then the peak ICU cases was 900 on May the 1st, at 2.9 times. Our cases started to fall then. because ICU cases lagged a little bit, active cases, and they fell about 3.5 times. Currently, where we are now, December 1st, we had 6,750 active cases, 155 in the ICU. We increased that by 3.5 times, almost quadruple. But our ICU numbers only went up by 1.06 times. So this is all saying that, yes, you know what, there's some evidence this Omicron is probably milder in our country as well, and certainly in our province. When we look at lag in hospitalization, so this is a concern, because cases went up, how do hospitalizations do? Well, January 12th was our first peak of cases confirmed positive, and our peak in hospitalizations was also January 12th. Second peak, April the 20th. Again, peak in hospitalizations, again, right on April 20th. And with the Omicron spike here, you see going up, you really don't see much in terms of the increase in hospitalizations as you did with the other waves. There is a 4 to 10 day lag in ICU admissions though. But the first peak, cases peaked on January 12th, ICU cases peaked on January 16th. The ICU cases peaked on April 20th, and then ICU cases peaked on May 1st. So there's anywhere between a kind of a 4 to 10 day lag in ICU admissions. So from all the data of which I'm aware and which I've looked at, shows that reduction in severity of Omicron likely outpaces the increase in transmission, such that severe outcomes will be lower in terms of raw numbers than with other waves. So let's talk about mitigation. When hospitals are overloaded and people are dying, mitigation is important, such as reducing shared airspaces, quarantining, isolating, contact tracing, those things. They're important. But with milder infections where hospitals aren't overloaded and few people are dying, mitigations probably cause more harm than good. Now, the early estimates are Omicron causes much fewer hospitalizations with shorter stays, and deaths are probably about 1/20th of the rate of Delta. So there's a point where disease is mild enough to not favor mitigations. I mean, we don't mitigate for the common cold virus. It generally looks possible that Omicron will be one of those infectious agents for which mitigations will cause more harm than good. So my concluding thoughts, it's important to be safe. Wear your mask. Get your third vaccination. Mitigation decisions should really be based on day-to-day, real-time data from our own country and those ahead of us, like Denmark. Modeling is an inexact science, as you've all seen, and basing projections and mitigation on modeling is inaccurate and probably not appropriate. I want to move to rapid testing. Everybody's trying to get these rapid test kits. I'm not. I'm going to tell you why. Rapid tests are only useful as there's lots of virus in the nose, where you swab. If you have a positive result, that means you've got COVID-19. So positive result in the rapid test is important and helpful. A negative result means you have no idea if you have COVID or not. You have no idea. Why? Why? What? Well, because 40 to 60% of people with proven COVID-19 can have a negative rapid test. Again, 40 to 60% of people with proven COVID-19 can have a negative rapid test. So do not rely on a negative test as a green light to say everything's okay. So should you get together for Christmas? This is always an individual decision in terms of risk benefit. Just like if you were to ask me if you want to go skydiving. Nothing's ever 100%, but think about the relative risk. Now, older people or immune compromised people who've not had their third injection really do need to take some care. But if you're vaccinated and your family members are vaccinated, you should feel relatively comfortable. Now, nothing's 100% safe, but when you talk about the relative risk when you're dealing with vaccinated and boosted people, I think you can feel comfortable enjoying the holiday. I certainly will. Mitigation, my final thought. Now, I am a conservative individual by nature. I have a hard time wrapping my head around the current mitigation measures in place, such as closing our schools, stopping all the sports, stopping all our other activities, based on the data I've presented to you today. It's time to move on. We need to keep our kids in school. We need to let people enjoy their lives and stop living in fear. And with that, I'd like to wish everybody a very safe and happy holiday season and Merry Christmas.